This patient in the picture here has a valgus deformity of the right knee. You see when she walks, her walking is very difficult. Actually both her knees are valgus, but her right knee is more such. These are intraoperative pictures which show the shaping of the knee before applying the implant. This is a preoperative X-ray comparing with the normal X-ray. So this is valgus deformity, and this is after the implantation of the implants, knee joint implants. You are seeing the post-operative X-ray. If you notice carefully, the knee has been straightened, and she is having a straight knee with good sutures. Now she is walking on the post-operative day 2. She is comfortable, quite pain-free, and is able to do her with a physiotherapist. This is a 3-month follow-up in which you notice the right knee, it is straight, and she is comfortably walking with good range of movement and good gait. Her range of movement is good. These are videos of a few more patients. 2 of these patients have undergone both the knees simultaneously, and the other 2 have undergone only one knee. One patient was brought in completely on the bed, and she is now walking, the leftmost patient.